Well, good morning, everybody. Thank you for joining us here. Today, we're going to be going over the PSM Health Plans. This is formerly, you guys probably know this as America's Choice. They had a little bit of a change over there, and so I'm going to have Hope here kind of get into it. And yeah, Hope, I'll let you take it away.
Sounds good. Thank you. Like you mentioned, my name's Hope McCullough. I'm the Business Development Manager here over at Health Plan Administrators. Just real quick, what you guys can expect from me. I do work closely with all of the brokers just to make sure that we are all, being compliant, helping to streamline any processes, answering any questions, and helping to navigate all of these changes. Like mentioned, there was a change with the PSM product with America's Choice. So the one thing I do want to touch on is that, America's Choice did do a lot of great things with this product, with getting that name out there and helping really just to grow things. Essentially, what happened is that we ran into some compliance issues, which is where I am kind of stepping in here and helping out with. Biggest compliance issues were with Blue Cross Blue Shield. Obviously, they are a very well-known and big carrier, so we want to make sure that we keep them happy. So really, it was how the plans were represented. So with this change, we just, we had to redirect things just to ensure that only those people that have completed certifications, that understand how the PSM, the Working Owner Program works, making sure that, those are the people that are sharing this opportunity going forward. So that was the biggest part of why there was change, just to make sure that we are meeting those standards when it comes to Blue Cross Blue Shield and that we aren't misrepresenting anything. So pretty straightforward. It's a lot of change. So everybody should be moved over into the new platform. And as we get those certificates and we see that things are updated, that is when those accounts will be made active. And so there has been a little bit of a struggle there, making sure that everything is moving over correctly. And just to kind of touch on that, you will still have access to your E123 with America's Choice. That's where all of your existing clients will remain until a point that they want to change onto a different plan, or you need to renew them into something new. Then you can move them over to the new E123. But for the most part, if they're happy, if they're good where they're at, just keep them where they are. You will continue to be able to monitor them there. Everything new going forward will be on that new platform. So to get started, just to share, the new updated information with you guys, what we're going to jump into today is just our recruiter broker guide. It's going to discuss the market opportunity, who our target clients are, what that market or working owner program looks like, plan information. We do have our 3 major medical plans and then our 1 limited medical. Pricing, that structure, what that looks like, the states that the products are available in, what those additional vendors are for these products. And then we do have a resource page at the very end that gives you all of the marketing materials. It is a live link within all of this, so it's always up to date. That way you don't have to wonder if what you're showing or what you're looking at is outdated by any means. So to get started with the market opportunity, really, what we're seeing, what everybody's seeing, what you guys are probably seeing as well, is that everybody is, well, I say everybody, a lot of people are looking to move off of the marketplace. We have over 1 million people each year that are looking for coverage elsewhere. Either they don't qualify for those subsidies, or they just, they make too much, or they need better coverage. They need true nationwide PPO coverage, lots of different reasons, but a lot of people are moving elsewhere. And so typically those people that we're seeing that are looking for coverage elsewhere are our 1099 workers, our self-employed individuals, our W-2 employees that just aren't offered traditional coverage through their employer. We're seeing a lot of associations and unions looking for that coverage. They want something that they can offer. And a lot of PEOs are looking for, an option for those smaller employer groups. So lots of great, great audience that you can market this product to. And then as far as the working owner program, just making sure that everybody truly understands how it works. Obviously, when you do the recruiter certification, it's going to go into a lot of detail. It's going to explain how to discuss this, how to talk about being the recruiter for this opportunity. But essentially how it works is PSM, Population Science Management, they are who hold the contract for the plans. Okay, so they are what put all of this together. And what they're doing is employing, the individual that we are helping to find a plan for, they're employing them as a consumer data respondent, or a CDR as most of us know them as. So essentially as a CDR, their job, their role is just to complete those surveys on their consumer and health habits. 5 to 10 minute surveys once a month or quarterly that they are then compensated for. So they are being compensated, essentially think of it as a quick little job that they do once a month at most. And in return, they're eligible for those group benefit plans through their employer, PSM. Okay. Again, they are compensated anywhere from $5 to $100 per survey that's completed. I think on average, we saw that it's more of that $25 to $55 range. So they are paid, a decent amount for completing a quick little survey. And then they will be receiving K1s at the end of each year that lets them know this is how much you earned for your employment this year. Okay. Some changes with the surveys. There is a new app. It's called Covered 365. So that is the new app going forward. That's where they will complete their surveys. That's where they can download digital ID cards, view claims, explanation of benefits, everything they need. It's all in that single app. It is available for the Gig Care product and then all of the other products as well. So all of it's within that Covered 365. And then with this, prior to discussing any of the products, if you've done the certification already, then you should know that you do need to complete that suitability assessment beforehand. So the 11 health questions, last 5 years, major pre-existing, your heart attack, strokes, cancers, if they've been incapacitated, major surgeries, things like that. Minor pre-existing conditions, so type 2 diabetes is perfectly fine. There's no questions about high blood pressure. We're not asking height and weight, no BMI questions, nothing like that. Really just your major pre-existing. So pretty straightforward there, as long as they've, if they're able to truthfully answer no to all of those questions and they are okay taking those surveys, then we can go ahead and discuss the opportunity of being a CDR and being eligible for those group health plans to them. And then kind of just discussing a little bit more, again, PSM, they hold the contract. The CDR essentially is just the individual that we are attempting to help find a health plan for. As long as suitability has been completed and they truthfully answered no to all of those questions, their coverage can actually begin on their effective date. So there's no additional underwriting that it will need to go through at the moment. So, go through the questionnaire, discuss the product with them that is the best fit, and then you can complete the enrollment and it is automatically accepted at that point. As far as the surveys, they are sent monthly reminders via text and email. There's in-app notifications through that Covered 365 app. Because they do a great job, there is no grace period for those late surveys. I want to say, oh goodness, I believe it was roughly 72,000 people enrolled into all of the plans in total last year. Less than 500 were kicked off for not completing those surveys in a timely manner. So it's an almost non-existent percentage, but we do want to make sure that they are doing those surveys. So that's why they send out all those reminders to them. And then we do want to make sure that we are submitting those applications by the 18th of the month, just to make sure that they are getting everything in the mail in a timely manner. As long as it's done by the 18th, they can have coverage that starts on the 1st of the following month, or you can pick 1 month out if they need that. And then it is direct bill, so the individual does have to make that payment. It does come out of their bank account or their debit or credit card. It is not employer sponsored, so the individual, again, does have to make that payment. That first initial binder payment is paid at the time of the application, and then it is auto drafted on the 20th of each month thereafter. So they do need to make sure that the account that they're using is going to have those funds on the 20th of each month. And then the first of the three major medical is our PSM Gig Care. So this is the plan that uses the Blue Cross Blue Shield of Nebraska network. Outside of Nebraska, it's going to utilize the Blue Card program, which if you're familiar with that, it's just comparable to your local Blue network in their corresponding state. With this plan, 5 options, 5 different deductibles. There's 3 PPOs, 2 EPOs. For the PPOs, we have the 1,500, the 2,500, and then we do have that 5,000 HSA. And then the EPOs, we have the 5,000, 7,350. Biggest thing with the EPOs, you just want to make sure that they do stay in network, as there is no out-of-network coverage aside from any major emergencies. Real quick, just to touch on the pricing structure and the state availability. All 4 of the plan options do have the 4 age bands, the 4 tiers. One thing with this, if you guys are not aware, is that the pricing is actually calculated on the enrolling subscriber's age. So that can be either spouse. So if you have, 2 spouses and one falls into a lower age band, you can actually put them as the main enroller. That way they get the lower price. So they would just be responsible for taking those surveys. So nice little way to save somebody a few bucks if they fall within 2 different age bands. And then state availability, it is in 41 states plus DC, and then down there at the bottom are the 9 states that it's not available in. So California, Hawaii, Minnesota, New Hampshire, Oregon, Pennsylvania, Vermont, Washington State, and Wisconsin. To jump back into the plans, second major medical is going to be our PSM of Tennessee, our RBP plan. So this plan does utilize the PHCS practitioner and ancillary network, and then that RBP is applied to your out-of-network services only. So any out-of-network doctors, hospital-related services, all of that is where that RBP functionality will kick in. So they do have the freedom to choose any hospital. However, they will need that single case agreement, for things like elective surgeries, any inpatient, outpatient services, things like that. Same pricing structure, like we just mentioned, the 4 age bands, 4 tiers. And then this one does have 7 different deductibles from 500 all the way to 7,350. And then we do have those 3 additional HSA options there. Up next is our PSM of Tennessee PPO option. So this one, again, major medical. This one is a true PPO plan. You do have the ability to pick between 3 different networks, depending on where your client's located, what doctors are in network for them, things like that. So it helps you just to make sure that you're putting them on the best plan available for them in their area, what they're needing, what their needs are. So you can choose between First Health, HealthSmart, and PHCS. For PHCS, it is actually their extended PPO network. So when you do a provider search, that's who you would look for. This plan, same deductibles, 500 through 7,350, but there's just the one HSA option with the 2,500. Again, same pricing structure with the 4 tiers and 4 age bands. And then our last medical option is our limited medical, our $1 million plan. So this one has the 3 different deductibles, 250, 500, 750. This one does use the PHCS practitioner and ancillary network for anything in network. Anything out of network is going to utilize the RBP functionality. With this one, again, called the $1 million plan, it does have a $1 million annual benefit with a $5 million lifetime benefit amount. So it is capped there. We can go through it in a second, but there are also caps on doctor visits. I believe it's 10 for PCP, specialist urgent care. There's 2 ER visits for illness, 2 ER visits for accident. There's a $15,000 cap per benefit year on maternity. So there's going to be some of those caps there as well. And then our key vendors, just to make sure that these products are well-rounded, that we have some additional services built in. We have ScriptAid. So this is going to have 3 different programs. This is just to help identify any additional resources where we can try to get those medications at lower cost if they are on the higher end. So we have PIP, which is our patient importation program. And this is going to, research and see if we can find any of the covered medications at a lower cost, typically up to 70% off, from places like Canada, Australia, and Mexico. PAP is our patient assistance program, and this is specifically for any non-covered medications. And this is for those that are financially qualifying for that program. If they qualify for it and we're able to locate those medications for them, then they will receive them at no cost. And then we have the self-pay importation program, which again is for non-covered medications, but it's going to be for those that don't financially qualify, and they will have self-pay rates that are typically between 40 to 45% off what they would see if they didn't use the program. For telehealth, we have My Live Doc that's built in, and that's going to give them 24/7 access to their primary and urgent care telehealth services, $0 copay for those two things. There are 4 free mental health visits included annually for each family member. And then I think we're up to 72 acute medications that are available at no cost if it's something that is prescribed through My Live Doc during one of their visits. In addition to that, we have DiaThrive that is built in, and green imaging. So DiaThrive is for those that are needing glucose testing supplies. They'll get those sent out to them free of charge. And then green imaging is just a diagnostic imaging service where it's going to help offset any imaging services that they may need. And lastly, like I mentioned, this whole presentation is a live link. And so when you get to the resource page, you'll be able to access all of the materials that are here. They are constantly updated as we get new information in. You can click on it and it's going to take you right to what you're needing. So a couple of things that you'll be able to see are the questionnaire. So we do have it where you can see everything that's on there. And then we do have the option where if you just want the questions only. So if you wanted to send it to your client, you'd be able to do so, and it would just only be the 11 questions. So again, heart disease, heart attack, surgery, stroke, homebound, if they're currently pregnant. One of the things I like to touch on there is that it's only asking if they're currently pregnant. So it's not asking if they've been pregnant in the last 5 years. That part doesn't matter. And then there is no waiting period. So if they were to get pregnant, let's say in 6 weeks, 2 months, they don't have to wait for that maternity coverage to kick in. It will be active for them. However, it is only for the enroller or the main enroller and their spouse. So any dependents 26 and under that are on the plan will not have that maternity coverage, but the 2 spouses will. And then you'll also be able to find all of the monthly contributions in there. You can look through all of those links are on the resource page. So if you are wanting the most up-to-date information, you'll be able to find it there as well. If you're new to this product, it is super easy to quote. Plans, the rates are the same across the board in all 41 states. So if you are talking to 35-year-old individual in Florida, or if you're talking to somebody in Texas, if you're talking to somebody in Utah, the price is going to be exactly the same. There's no change to it. So this one right here is going to be for the gig care, that Blue Cross Blue Shield network. And then this is for the RBP. And then we have this one just to kind of touch on the limited medical plan. And you can see where those caps are, the 10 visits, the emergency room visits, inpatient services, things like that. All of the plans are ACA compliant. With that, they will cover your preventive, your wellness, and immunizations 100%. So those things are covered on all of the plans. So if you do have anybody that's asking, you can let them know it is compliant there. And then here are those monthly contributions for the $1 million plan. This typically is going to be, the most cost effective. Those plans run from $289 per month all the way up to $949. Obviously, if somebody's interested in this, you need to be aware that they do have those caps. But other than that, that is, what we're offering for the PSM. The America's Choice name is taken off of all of the names now, so it will just be, the PSM Gig Care, PSM of Tennessee, the RVP and PPO option, and then that $1 million plan with the limited medical. With that, that is all I've got for you, Taylor.
Perfect. All right. Well, I'm not seeing any questions, so I'd say let's go ahead. We'll just wrap it up here. If anybody has any questions or anything at a later time, feel free to give us a call here at Western Marketing. And you guys should all have the number, but it's 800-852-7152. And with that, everyone have a great day.